So, hello guys, I just want to check the mic if everything's good, and we'll be ready in a few minutes. So, thank you, and yeah, I will be back. Mic if everything's good, and we'll be ready in a few minutes. So, thank you, and yeah, I will be back. So finally, yeah, sorry it took a while for me to actually finish this. There's just a lot of problems with regards to dealing with live streaming, which unfortunately is very slightly difficult for me. So anyway, this topic is entitled Coping with COVID-19, because I wanted to, well, actually, a few days ago, I was talking with one colleague of mine, and he was really what's the term, demoralized with regards to what's happening. I mean, he's a frontliner. He deals is a emergency what's this physician, emergency room physician, and he was going through a lot of really stuffs that I wanted to what's this, to help him. And I know that there are a lot of people right now who are going through the same thing, which is one of the reasons why I actually made this presentation. So this is entitled Coping with COVID-19, Discussions on Mental Health Issues specifically relating to the pandemic. Okay. So just a basic channel etiquettes. Everyone is welcome. Be respectful above all else. Unethical and illegal activities here are not welcome, especially if you are dealing with cybercrime, drugs, and most especially privacy violations. And harassment in any form or shape will not be tolerated, with focus especially on marginalized people. And if you or you know someone who is suicidal or in emotional distress, make sure to contact the National Suicide Prevention Lifeline Hotline, which is 1-800-273-TALK. And if the situation is life-threatening, it's much better to call an emergency assistance or 911. So yeah, our agenda. So it's supposed to be 7, but unfortunately it's very late now. But you know, the internet is working with me a lot better. So introductions and objective setting. This is followed by presentation and discussion, and hopefully later we can do networking. So basically, these are objectives to discuss COVID-19 and its implications in mental health. to discuss strategies and recommend interventions on how to cope with COVID-19. So this is really I wanted to discuss the basis of COVID-19. So it was in January 2020 when the World Health Organization declared COVID-19 as an outbreak, and it was only recently, I think it was around March, when they decided to call it a pandemic. Actually, if I remember correctly, CNN was actually one of the first networks to actually mention that, early on, that it was a pandemic, because there were already telltale signs of it becoming a pandemic. So, not of course, the WHO actually did something. WHO and the public health authorities on the world were really acting to contain the outbreak initially, which started initially in China. But then again, once it started spreading, they found out that it has high infectivity and fatality rates, and basically, other than deaths and its effect on the physical body, there's also the massive psychosocial impact by causing mass hysteria, economic burden, and financial losses. A lot of people, especially at the time, New York was badly affected. It was where the first area was, definitely, and people were feeling the brunt of the virus. And I personally know a lot of friends who died, and colleagues as well, and it's heartbreaking. One of my colleagues actually mentioned that it becomes personal when you actually know somebody who died, and like you worked with that person, and finding out a few days later that the person actually died, it has a deep psychological impact. So this is why I wanted to discuss this. So previous studies have discussed an intense and wide spectrum of psychosocial ramifications that pandemics can inflict on general population. In fact, there's the term they call coronaphobia, wherein there's mass fear of COVID-19. Other than that, there's also uncertain character and unpredictable course of the disease, and there's also intolerance and uncertainty. There's a perceived risk of acquiring infection, which can generate negative psychological responses, including maladaptive behavior, emotional distress, and avoidance reaction among common people. Okay, but before we continue on, I would like to do a little break first to check if you are still, awake, or yeah. Actually, it's 12 midnight now here, so yeah. So anyway, yeah, it was. I hope you have a good break. I just wanted to check the microphone on and if it's working. So I finally found out that it's working. So yay! Finally, I'm able to live stream. This is the first time that I'm actually doing live streams. I'm very excited about this one. So anyway, let's go back. So this so there are previous studies that showed intense and wide spectrum of psychosocial ramifications that pandemics can actually inflict on the general population. So one of the I'm a family physician, and one of the things that I was actually trained on is called the biopsychosocial aspect of healthcare. So when we look at people, for example, or persons, we always look at it in the context of its biological, the physical aspect, the psychological, and finally the social aspect of a person. That because ultimately, when you treat somebody, you're not just treating the disease, but you're treating the whole person. So the whole person is complex, is complicated. So you have to understand all these psychosocial ramifications, and this is why COVID-19 is such, I think, a challenge for us to treat, because it encompasses practically everyone from every aspect of life. So in China, actually, they made observational studies because it was where it was first identified. They did an online survey. They did a cross sectional self-rated questionnaires, and they looked at different groups of people. So they initially looked at general population. They looked at medical staff who are treating the patients with COVID-19, those who are with the general public and who are non-frontline and frontline nurses, and then individuals who are in self-isolation. Most of the study instruments that they used were the depression scale, anxiety and stress scale, and the impact of event scales. And what they find out was really it just what's this strengthened the findings or the assumptions that we have, that a severe it has severe impact on the mental health aspect of patients, that of everyone, of individuals. So COVID-19 is not just a biological disease that we can just treat with a vaccine, for example, or prednisone, like this a steroid for that matter. It's a complex disease that has also not just immune aspect, but also mental health aspect. So these are just some of the things that they found out. 16.5% manifested with moderate to severe depressive symptoms. 28.8% had moderate to severe anxiety, and 8.1% had moderate to severe stress. The mean anxiety score was actually very high, and they found out that anxiety positively correlated with stress, and which we all know already, which negatively with sleep quality. There's also a support system and self-efficacy. They found out mostly that when people are thinking a lot about the disease, sometimes you sleep late and you have all this because you're very anxious. There's also a level of trauma that's related to COVID-19, especially among frontline workers who are initially exposed to the disease. And the other aspect is really, if you look at the psychosocial impact of COVID-19 on different strata, they found out that one of the psychosocial issues that for patients who were positive, who tested positive and quarantined, there's loneliness, there's anxiety, there's panic, there's PTSD, and then there's also depression. For healthcare providers, there's also a feeling of worthlessness, guilt, the overwhelming work pressure. There's deprivation of family while in quarantine. There are burnouts, especially physician burnouts, which incidentally we did we did a project actually with as part of our entry when I joined the MIT competition. I think that was last year. We wanted to address the problem of burnout. And also for children, there's also boredom, there's irritability, there are developmental issues, there's also fear of infection, and then especially for people who are old, there's irritability, there's deprivation because they are unable to go to their physicians. Imagine it's for 3 months they had to self-isolate themselves, and they're unable to go to their physicians and have their regular checkup. So it really affected all aspects of our life. And these are just so the title is really COVID, coping with COVID, right? So these are just some of the interventions that they did. So they secure communication channel between patient and family. So I think it's very important to emphasize that communication is key to everything. So make sure that if you are positive, or you're self isolation, or if you are a carrier, for example, make sure that you always have this process, or this system of communicating to your loved ones. And then delivery of progress of reports, which is essential for COVID positive patients, and close monitoring of mental state, in-time referral, psychotherapy by stress adaptation model, and psychiatric follow-up post-discharge if needed. Another intervention that they did was support from higher authority. Higher authority here would refer to, for example, government institutions, or not necessarily government institution, but also like your boss, for example. It helps a lot if your superior can actually understand what's happening. And there should also be clear communication on regular basis, sustained connection with family and friends, shorter work duration, sufficient supply of appropriate PPE, which is currently one of the major problems right now for healthcare workers, and arrangements of a well-equipped isolation wards, and then long-term psychological follow-up. So these are just some of the interventions and recommendations that they suggested. And then for children, proper parenting, online classes. Right now, I know there are a lot of problems with online classes. There are a lot of issues that come up, but I think it's still the best way to to prevent infection. Unless there will be a vaccine, then most probably it's online classes would still be the. I mean, it's not perfect, but we just have to learn to to adapt and to use all the necessary technological tools that we have, so that we won't get infected. So there's also they also suggested clear and direct, open, and detailed information about the disease, and then precautionary measures. Precautionary measures here would include proper washing of hands, and then using 60% alcohol, for example, disinfecting your workplace or your area. Maintenance of a sleep cycle, physical exercise is very important. I mentioned educate about proper hygiene practice, and then home-based physical exercise required, and especially for older individuals. And I think it's also important here to emphasize that there should, for especially for older individuals, there should be regular sessions by telephone or online video conference for physician guidance and mental health services. So how do we cope with COVID-19? Actually, this is supposed to be like a 5-minute break. So yeah, okay. what are the current recommendations by the World Health Organization? So this is the World Health recommendation to the general public. COVID-19, when we refer to people with COVID-19, it's very important to not attach the disease to any particular ethnicity or nationality. It's important to be empathetic and to those who are affected in from whatever country that person comes from. It's also important for people who are affected by COVID-19 to emphasize that people who have COVID-19 have not done anything wrong, and they do deserve support, compassion, and kindness. One of these days it might be one of us. Do not refer to people with disease simply as COVID-19 cases, victims, COVID-19 families, or the diseased. They are people who have COVID-19, people who are being treated for COVID-19, and people who are recovering from COVID-19. It is important to separate the person from having the identity defined by COVID-19 in order to reduce the stigma. Practically, what we're trying to say here is that we should have learned a lot from the HIV epidemic that's still happening right now. And looking at the person as a whole, and not just a disease, but as a total person, looking at the person and then realizing that a person consists of a biological, the psychological, and the social aspect is very, very important. The WHO also suggests minimize watching and reading of news related to COVID-19 where it causes you to feel anxious and distressed. It's important to only refer to information, especially on trusted sources. Seek information updates at specific times during the day, once or twice. And then protect yourself. This is very important. Assisting others in time of need can benefit both person receiving the support of the helper. It's important, other than being supportive to others, that you also try to protect yourself. Working together as one community can also create solidarity in addressing COVID-19 together. Find opportunities to amplify positive and hopeful stories, positive images of local people who have experienced COVID-19. It's important to have our stories emphasized. I was actually New York actually has a lot of communities right now, and they're coming up with very interesting stories on coping, people who went through the disease and survived, and all that. It's also important to honor carriers and healthcare workers supporting people affected by COVID-19. Acknowledge the role that the healthcare workers are doing, especially with keeping our loved ones safe. I remember there was a story back in the Philippines where one frontline healthcare worker was actually attacked, and that's not good. That's a terrible thing to actually do. And this is the WHO message for healthcare workers. If you're feeling under pressure, is actually a very normal thing, and it's what a lot of people are actually feeling. Even me, for example, it's quite normal to be feeling that way, and stress and feelings associated with it are by no means a reflection that you cannot do your job or that you're weak. It is important to manage your mental health and psychosocial well-being during this time as important as managing your physical health. So again, going back to the looking at the person and the biopsychosocial aspect, it's important to also look at not just your patient but also yourself. It's very important to identify to see, especially at this day, especially with COVID-19. You see, it's actually. I always look at it as in school, in medical school, right? We learned a lot of these things. If you're a nurse in a nursing school, in emergency in emergency room training, you learn all these things, and yet you never have you always applied them mostly to your patients, right? It's important at this time as well to apply everything that we actually learn, not just to our patients but also to ourselves. So taking care of yourself at this time is very important. Try and use hopeful coping strategies, such as ensuring sufficient rest and respite during work or in between shifts. It's important to engage in physical activity and stay in contact with family and friends. Avoid using unhelpful coping strategies such as alcohol, drugs, because it can worsen your mental and physical well-being in the long run. Some healthcare workers may unfortunately experience avoidance by their families, especially to the stigma and fear. Not just families, even entire communities will actually sometimes shun. So we should be prepared for things like this happening. If possible, staying connected with your loved ones through digital methods is one of the best ways to maintain contact. Turn on to your colleagues, your manager, and other trusted persons who understand what they're going through. I remember actually a few years back, yeah, I was moonlighting at one of the hospitals in Quezon City, and it was I mean, back at that time, they didn't know how to manage meningococcemia. It was a very small hospital. I think it was a secondary hospital. They did not know how to manage a patient with meningococcemia, and I had to like find a way to make my senior at the time understand that I think for most physicians they would rather, I mean, not for especially for small hospitals, they would rather not manage what's this a very complicated case like like an infectious disease. And I think what COVID-19 is doing right now is that it exposes it exposes us to our extreme fear and weakness, right? So it's important to understand. Back then, I really like I studied on how to protect myself and how to protect the staff. For example, in the case of meningococcemia, and COVID-19 is actually, I mean, a lot worse in the sense that it's there are studies right now that it's airborne, so it's practically saying that nowhere is safe, and that's a terrible thing. But again, looking back at what we were taught in medical school or in school, the principles of infectious diseases, the principles of epidemiology, all this, the principles of even the Darwinian theory, if you're a biologist for that matter, they've always been the bedrock of how we see the world, how we see the world, how we treat our patients, and how we treat ourselves. So this is also a way for us to apply the things that we learned in class. Use understandable ways to share messages with people, with intellectual, cognitive, and psychosocial disabilities. Know how to provide support to people who are affected with COVID-19. This is especially important for those who require mental health and psychosocial support. And the stigma associated with mental health problems may cause reluctance to seek support from both COVID-19 patients and mental health conditions. So this is another aspect that we have to consider, especially if we are treating patients with COVID-19. So what is the World Health Organization message to team leaders? Keeping all staff protected is the primary concern. Focus on longer term occupational capacity that rather than repeated short-term crisis response. Ensure that good quality communication and accurate information updates are provided to all staff. It's important to rotate workers from higher stress to lower stress functions, partner inexperienced workers with more experienced colleagues. There's a buddy system to help support and monitor stress and reinforce safety measures. In a lot of kindergarten schools actually have a buddy system, and I know in even in med school, actually, I remember Tony was my buddy system. I remember I would always complain because she was a lot taller than me, so she would, whenever she walked, it's like two steps for me. So it's important, especially this time, to ensure that your juniors have a buddy system that can provide support, monitor stress, and reinforce those safety procedures that we have. Ensure that the staff are aware of how they can access mental health and psychosocial support services, and managers and team leaders are facing also similar stresses and may experience additional pressure relating to the responsibilities of their role. Orient all responders, including nurses, ambulance drivers, volunteers, case identifiers, on how to provide basic emotional and practical support, especially to those affected people. And this is actually very important, to manage urgent mental health and neurological complaints within the emergency or general healthcare facilities. It's important to also have appropriately trained and qualified staff, and ensure availability of essential generic psychotropic medications in all levels of healthcare. especially among people who are living with long-term mental health conditions. And these drugs are very important, and it should be insured. The drug should be insured of uninterrupted access to their medications. What about for those children who take care of children? So it's important to help children find positive ways. Children feel relieved if they can express and communicate their feelings in a safe and supportive environment. So I emphasize the need for having a supportive environment. Keep children close to their family, and if considered safe, avoid as much as possible, avoid separating children and their carers as much as possible, and ensure that this regular follow-up. If you cannot go there physically because of the quarantine right now, it's important. You can message or use technology to contact your physicians, your pediatricians, for example, and maintain familiar routines in life. Provide engaging with age-appropriate activities for children, which includes activities for their learning. Right now, again, as I mentioned, there are a lot of issues with regards to online or distance learning, but I think it's the way to go, especially because up to now we still do not have a definitive treatment yet, like a steroid or like what's this, a real treatment. What we're having right now actually is just it's not a direct, we're just trying to prevent the complications. So for example, you give steroids to help prevent inflammation, so, and you cannot use that, of course, regularly until, I guess, a vaccine is identified. Then more or less we'd be at least feeling a bit safe. But of course, we have to ask, with all this data about vaccines, we have to do, of course, they're going to do a safety test first, and it's important that they also identify, what does a successful vaccine look like in the long term. During times of stress and crisis, it is common for children to seek more attachment and be more demanding of parents. So it's important to discuss COVID-19 with your children in an honest and age-appropriate way. So if your children have concerns, addressing them together may ease their anxiety. Children will observe adults' behavior and emotions for cues and how to manage their own emotions during these difficult times. What about for older people or people with underlying conditions and the carers of this specific demographic population? Older adults, it's difficult when you're living in isolation. Sometimes a lot of them may become more anxious, angry, or stressed and agitated, or even withdrawn. So it's important to provide practical and emotional support through informal networks such as families and healthcare professionals. I think some people are actually using covering. They can hug, but of course, or like in the glass, they say hi, and just to make sure that they can see you. Share simple facts about what is going on and give clear information about how to reduce the risk of infection. And then, of course, repeat the information whenever necessary, and make sure that the information that you relayed is clear, concise, and respectful for the patient. And if you have underlying condition, make sure you have access to all these medications. If you have hypertension or diabetes, make sure you are still able to they're still able to access these medications, and activate your social contacts to provide you with assistance if needed. Be prepared to know in advance where and how to get practical help if needed. So like a cab, for example, having food delivery, and requesting medical care. The thing with New York, especially right now, because they, especially with their older group, they have the city has a way of giving this food. So no senior citizen in New York actually gets hungry, because they make sure that food is delivered, or the person has something to eat. Make sure that you have up to 2 weeks of regular medicines that you may require, sometimes even 2 months or a month, especially with what's happening right now. Learn simple physical exercises to help you in isolation or in boredom. keep regular routines and schedules as much as possible to help create new ones, including, of course, regular exercise, cleaning, doing daily chores, singing, keeping regular contact with your loved ones via telephone and email or social media or Zoom video conference. A lot of people are doing Zoom now. What about for those people who are living in isolation? It's very important to stay connected and maintain your social networks. Try as much possible to keep your personal daily routine and then stay connected. That's actually the primary message here, is that as much as we are isolated, we have to find a way to communicate, because we are social beings, social creatures, and the bad things happen if we become isolated. During times of stress, pay attention to your own needs and feelings as well. Exercise regularly, and it's important to understand that a near constant stream of news about everything can cause anybody to feel anxious or distressed. So it's best to limit, or to watch the news only at least once a day, and avoid going to websites that are not really says good. I mean, and by good I mean the information is more of creating panic, or the information is more of propaganda and all that. It's important to go only to websites which are. This is actually one of the reasons why I made this live streaming. It's for people to go to websites that are reputable, and in a sense, because misinformation right now is predominant. I mean, it's all over the web, and it's important for us to especially those in the medical community, the medical field, the scientists, to understand and to really push through with with a scientific agenda. So our final thoughts: COVID-19 affects all people of different sections of society, and right now we all know this. There's a mass fear, or coronaphobia, they call it. Marginalized communities, daily wage earners, frontline healthcare workers are disproportionately vulnerable, not just to the disease, but to exclusion, to stigma, and discrimination. So it's like putting another layer of problem. And mental health should also be identified when discussing about COVID-19. The World Health Organization recommends inclusion of mental and psychosocial considerations in the national response. But the primary message that this emphasizes, really the message of communication. Always, communicate, talk to somebody you know as a loved one, or a significant other. It may not be family; it may be a lover, a boyfriend, a girlfriend, or somebody. And with this, technology can be a tool as adjunct to social distancing and still maintain relationships with our loved ones. This is last quote actually that I lived by. I was privileged enough to actually when I was first year medicine, I was one of her her students, and she said this in one of the conferences. I don't remember what it was, but I remember the words that she said. She said that we may not be able to cure you as a physician, as a family physician, as a physician in general, that we may not be able to cure you from all the afflictions of this world, but we can help you make it bearable. And this is from Dr. Lani Nicodemus, and it's really a message of hope and understanding. And it's not about a lot of people see this as more of palliation, but as physicians, as healthcare workers, as frontline workers, at the end of the day, we may not be able to cure you. I mean, if you look at the statistics right now, 4 million COVID cases. There are around how many? I think 600. 130 plus thousand deaths in the United States, and globally it's 600 or something. And it's hard to put people in a statistic. No one wants to be placed in a statistic. I mean, regardless of how science, how math oriented we all are. At the end of the day, we always look at people not just as, as disease, as a statistic, but looking at the person as a whole, looking at the person in its biological, looking at the person in its psychological, and looking at the person in a social aspect, because only then, we will be able to truly understand, what our purpose is in this world, in this life. We only have one life to live, according to Hillary Clinton. And we have to make sure that we make it bearable for the rest of us who don't have it good. So yeah, thank you so much for listening, for spending your Fridays with me, or Saturdays if you're in the Philippines, and or Eastern Western time. I keep have a problem with that one, but yeah, thank you, and hopefully I will be able to make more content, more material for my next blog. So thank you, and I hope you're having a good day. Always take care of yourself. Bye, guys.